Minority Leader.
Thank you, Mr. Speaker. I ask unanimous consent that all members be given 5 legislative days to revise and extend their remarks and add any extraneous materials relevant to the subject matter of this discussion.
Without objection.
Mr. Speaker, I rise this evening along with my colleague, Congressman Hakeem Jeffries, from the 8th Congressional District of New York, for tonight's Congressional Black Caucus Special Order Hour, Bridging the Divide, a call to action by the Congressional Black Caucus to eliminate racial health disparities. Mr. Speaker, tonight the Congressional Black Caucus comes to this House floor to discuss our overarching goal of promoting equality for African Americans across the health care spectrum. Mr. Speaker, it is well known that poverty, social economic status, and health disparities are closely linked and latched together. For example, individuals with low income tend to have more restricted access to medical care and face greater financial barriers to affordable health care, oftentimes contributing to health disparities. Last week, Mr. Speaker, the House Republicans released their conference's poverty plan called A Better Way. Unfortunately, but not unexpectedly, this Republican anti-poverty proposal isn't a better way, Mr. Speaker. It isn't even a new way. Quite frankly, Mr. Speaker, it's the wrong way. It uses the same trickle-down, discredited policies that House Republicans have put forth in the past. This House Republicans' poverty elimination proposal would repeal the Affordable Care Act and undermine the affordable, quality health coverage that millions of Americans are now enjoying. It would also cut Medicaid. It would cut the Children's Health Insurance Program that we refer to as CHIP, and it would end the Medicare guarantee. Programs with even proven successes, Mr. Speaker, in reducing health disparities. So this is in part why we are here tonight. We know that health coverage is the first step in securing better health care outcomes, and Medicaid and CHIP play a vital role in opening a doorway to the needed health care, especially for our children. As we address the most pressing challenges in achieving health equity and equality for African Americans, I want hardworking American families to know that they have voices in Congress that aim to protect their safety, invest in their future, and provide affordable health care for all. With the Affordable Care Act, which every member of the Congressional Black Caucus supported when it passed, we have improved access. We have improved affordability and the quality of health care. So tonight, Mr. Speaker, I want to thank President Obama for moving the needle forward and helping American families, African American families across this great country and nation to have the financial and health security that comes with health care. So, Mr. Speaker, we cannot repeal the ACA. We must continue to improve and strengthen it, and we will still have more work to do. The Congressional Black Caucus, from its very inception, has long been the voice for bridging the divide on racial health care disparities. No, Mr. Speaker, we have been the voice for standing up for American people, and especially individuals who are African American, against all disparities. And we will not only come to this floor tonight, we will continue our fight, and we will continue to come to this floor. Tonight, you're going to hear a lot of our members weave together our poverty plan. You're going to have members talk about gun violence. You're going to have members talking about that all lives matter. Because if we don't end the gun violence, then we're not going to have a healthy nation. Tonight, I want to applaud my good friend and my colleague, Congresswoman Robin Kelly, from the 2nd District of Illinois, chair of our Congressional Black Caucus Health Brain Trust. I want to commend her for her report, the 2015 Kelly Report on Health Disparities in America, the official congressional analysis of the state of African Americans' health in the United States, and her work on the 40 under 40 leaders in America. Leaders who are under 40 who are physicians and medical professionals. And lastly, let me just thank her for her courage and her leadership, for recognizing that all lives matters, and we cannot come to this House floor and talk about poverty programs and talk about health care and talk about education and talk about finance if we do not bridge the gap with gun violence. I salute her for no longer standing up until we make a difference. So tonight, we're coming, Mr. Speaker, with a strong call to action for us to keep this wonderful America helpful. You will hear from Congresswoman Kelly momentarily. But, Mr. Speaker, at this time, I would like to bring our chairman of the Congressional Black Caucus, our chairman who has been a longtime advocate and voice for not only the Congressional Black Caucus, but for his constituents in his congressional district in North Carolina. But tonight, he speaks for us. Tonight, he speaks for the call of action, of us bridging the gap. And at this time, I am honored to ask Congressman G.K. Butterfield to make his comments.
Let me thank you, Congresswoman Beatty, for yielding time this evening. This is such a sad evening for all of us because of the events in Orlando, but thank you so very much for having the strength to come to the floor tonight to manage the important topic that we are all so concerned about. To Congresswoman Robin Kelly, thank you for your incredible work chairing the CBC Health Brain Trust and all of the work that you do related to health disparities in this country. And thank all of my colleagues who are going to speak tonight for your tireless work. Before I begin my remarks, let me just say that I sat on the floor a moment ago and listened to Congresswoman Corrine Brown, and it was an incredible one-minute speech that she gave. And I just want to share in her sentiments this evening and to align myself with the pain that she and her constituents are facing in Orlando. The mass shootings were absolutely horrific. Unthinkable under any definition. They are just unthinkable, and my prayers go out to the families in Orlando for their pain and for all that they're having to endure because of these mass shootings. As someone said a few moments ago, a moment of silence is not enough. It is time for this Congress to act. It's time for this body, Mr. Speaker, to have a serious debate about gun violence and to pass legislation that will deprive people the right to own a high-capacity assault weapon and high-caliber bullets and use them to kill innocent people. Now is the time. 136 mass shootings have taken place during the first 164 days of this year. That is a sad statistic that we must address. The United States is 5% of the world's population, yet we are 31% of the mass shootings in the world. It's time to act. But let me talk about the topic tonight, Ms. Beatty, very briefly. The Congressional Black Caucus has been committed to advancing access to affordable health care for all Americans so that we can eliminate racially based health disparities. That's been our mission for many years. Eliminating health disparities means addressing inequities in environmental conditions, social and economic conditions in all of our communities. By all measurable statistics, from health outcomes to participation in health professions, African Americans lag so far behind. For example, more than 40% of African Americans have high blood pressure. a rate that is one of the highest in the world. African Americans are more likely to develop hypertension at a younger age and are at higher risk of stroke, heart failure, end-stage renal disease, and death from heart disease. Stroke, Mr. Speaker, is the third leading cause of death in the United States. African Americans are 50% more likely to experience a stroke than white Americans. That is a fact. According to the Federal Centers for Disease Control and Prevention, African American children are twice as likely to have asthma as white children, and black children are 10 times more likely than white children to die of complications from asthma. African Americans were, on average, 6 years younger than whites when they suffered sudden cardiac arrest. Cardiac arrest incidences among African American men was 175 per 100,000, whereas the incidence of white males was just 84 per 100,000. Cardiac arrest in African American women was 90 per 100,000, as opposed to 40 per 100,000 for Caucasian women. Another illness which disparately impacts the African American community is that of prostate cancer. In June of last year, I introduced the National Prostate Cancer Plan Act, a bipartisan bill which seeks to establish the National Prostate Cancer Council on screening, early detection and assessment and monitoring of prostate cancer. Prostate cancer impacts 1 in 7 American men and is the second leading cause of cancer-related death among men in the U.S., with nearly 30,000 deaths anticipated just this year. African-American men are particularly vulnerable as they are twice as likely to be diagnosed with prostate cancer and 2.5 times more likely to die from the disease than their white counterparts. Just last week, House Republicans released their Better Way agenda to address poverty, but that proposal, like others they have released, will not lift Americans out of poverty. In some cases, these types of proposals can actually push low-income Americans even deeper into poverty, further limiting their access to health care and exacerbating health disparities. And so, Mr. Speaker, it's time for us to continue our efforts to address the health disparities and barriers, and that is what the Congressional Black Caucus is advocating this evening, and we're going to continue this work until every disparity is removed. I want to thank you for your courtesy, Ms. Beatty, and I yield back.
Thank you so much, Congressman Butterfield. And thank you for making us aware of 136 mass shootings in 164 days of this year. Certainly that is relevant to tonight's topic, because whether it is death by guns or death by health care disparities, there's too many deaths. And I think you said it so well when you provided the data and the statistics of African American men and their mortality rates and what's happening to them. And yes, African Americans lag behind, and that's why we stand with you, bridging the gap, and for this call of action. Thank you. At this time, Mr. Speaker, it is indeed my honor to ask Congresswoman Robin Kelly from the 2nd Congressional District of Illinois, my colleague, my confidant, and my friend. She is a champion of expanding health care. She is a champion, Madam Speaker, of making sure that we understand that health care disparities must end. She is the chair of the powerful and most prestigious Congressional Black Caucus's Healthcare Brain Trust. Strives to increase healthcare opportunities for all, for our children, for our senior citizens, and for residents of the underserved community. At this time, it is indeed my honor to ask her to provide some information on today's topic.
Thank you so much. I want to thank my colleagues and my classmates. the gentlewoman from Ohio, my friend, Ms. Joyce Beatty, and the distinguished gentleman from New York, Mr. Jeffries, for leading this important conversation about bridging the divide to eliminate racial health disparities. But I can't weigh in on that topic until I first address the horrific events of yesterday in Orlando, Florida. Our nation is horrified and heartbroken by the tragedy in Orlando. We are disgusted by this brutal attack. We will not tolerate terrorism or hate in any form against any group of people because this is just not our way. These ideas of hate will not endure because there is not strength to them. We will win the battle against terrorism and intolerance. We will hold leaders accountable who put their NRA score ahead of the need to keep guns out of the hands of terrorists. We will stand with the LGBTQ community and value their lives, their health, and their security from the threat of violence and hate. And we will work to see that all Americans enjoy the very same freedoms and protections. We've done a lot of moments of silence, but I believe in showing respect through action, not silence. And that is why we are here this evening to discuss what divides us as a country in a health sense. For 45 years, the Congressional Black Caucus has been out front in Congress in fighting for these freedoms and protections. And when it comes to the matter of health equity, I have worked to champion the health policy concerns of vulnerable communities as my predecessors in the Congressional Black Caucus Health Brain Trust, the Honorable Louis Stokes and Dr. Christensen, have done. Some of my colleagues here know this, but I want to repeat it for anyone who doesn't. Before he was killed, Martin Luther King was quoted as saying, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." I couldn't agree more. And as the chair of the Health Brain Trust, I've worked with many of the people in this room to focus on advancing this critical phase of the human rights and civil rights struggle, health equity. When Benjamin Franklin created the nation's first public hospital, the Pennsylvania Hospital, he did so in order to establish the promotion of public health as a core American value. He did so to care for our nation's diseased and sick poor. Nearly 300 years later, the Affordable Care Act cemented health care as a fundamental right for all Americans. Yet today, we find ourselves at a crossroads in health care. Health disparities in communities of color continue to be intractable hurdles in the quest to achieve health equity in America. African Americans are infected with HIV at a rate that is 8 times that of white Americans. While white women are more likely to have breast cancer, African American women are 40% more likely to die from the disease. African Americans, Latinos, Asians, and Pacific Islanders, as well as Native Americans, are diagnosed with lupus 2 to 3 times more frequently than Caucasians. More than 13% of African Americans aged 20 or older have diagnosed diabetes. And people of color are 2 to 4 times more likely than whites to reach end-stage renal disease. This grim snapshot illustrates that despite the gains we've made since the days of Ben Franklin and the ACA, there is still much ground to cover in closing the health equality gap. Last year, I drafted a comprehensive report, the Kelly Report on Health Disparities, an official congressional analysis of the state of minority health in the U.S. that offers a blueprint for reversing negative health trends in communities of color. The Kelly Report brought members of Congress together, medical professionals, and public health thought leaders to examine the root causes and impact of health disparities in America and provide a comprehensive set of legislative and policy recommendations to address them. The whole can only ever be as healthy as its parts. For America to achieve true health equity, lawmakers, community leaders, and industry stakeholders must come together and aggressively work to reduce disparities nationwide. We all have a part to play in creating a healthier America. We must take heed of Dr. King's words. Of all the forms of inequality, injustice in health care is the most shocking and inhumane. And we can and we must fix that. And again, because of what happened in Orlando, and I want to say it's the mass shooting that we're talking about and it's tragic, but the night before, one person was shot. And I often liken this to a 747 crashes. We talk about that, but we don't talk about the two-seater. And that two-seater, the person that died alone, and that club, after she sung Friday night, has a brother, a mother, a father, and their pain is just as harsh. So let's not forget that young lady that lost her life, and she did not lose her life to someone that was Muslim or someone that believed in ISIS. She lost her life to an American young man, a Caucasian. So thank you, and I yield back.
Thank you, Congresswoman Kelly. And how appropriate for tonight for you to remind us, as I ask you to constantly do, about why we must, to put it in your words, come together. We must do something. Madam Speaker, tonight we say to you and to our Republican colleagues, come together and do something. To you, Congresswoman Kelly, let me say, let today serve as a turning point in our nation's ongoing struggle to stamp out hate of all forms. We must mourn those who lost their family members, but we must do more than mourn. We must have action. If we're going to have the hope for a better America, hate has no place in this great nation. So I thank you and will continue to remind others that we know firsthand what it does to our communities. But Madam Speaker, we stand here tonight speaking to all communities. But here is what we know. The NAACP has shared with us that African American children and teens accounted for 45% of all child and teen gun deaths in 2008 and 2009, but were only 15% of the total child population. The FBI says that approximately 47% of victims of the 165,000 homicides from 2000 to 2010, including over 111,000 gun-related homicides, were blacks. The Children's Defense Fund, Madam Speaker, says that in 2010, black males between the ages of 15 and 19 were nearly 30 times more likely to die in a gun homicide than white males of the same age, and more than 3 times more likely to die in a gun homicide than Hispanic males of the same age. So, Madam Speaker, tonight you will hear us repeatedly make a call for action. You will hear us repeatedly quote great leaders. And I think worth quoting again what Congresswoman Kelly said in the words of Dr. Martin Luther King: of all the forms of inequality, of injustice in healthcare, healthcare is the most shocking and inhumane of all inequalities, of all injustices. And as we speak of great leaders, it is indeed my honor and my privilege to ask my colleague, Congressman Donald Payne from the 10th Congressional District of New Jersey, a man who has made a name for himself, a man who understands firsthand as a father of triplets, as a spouse, as a ranking member on Homeland Security's subcommittee on emergency preparedness, response, and communication. A man who has been at the forefront in his community, a man who served before coming here as an elected official, but more importantly, a person who understands health disparities and the call for action. It gives me great honor to ask Congressman Donald Payne to share some wisdom with us tonight.
Well, thank you. Madam Speaker, first want to start by thanking Congresswoman Beatty for that very kind and generous introduction. We in our class are very proud of our colleagues, and we support each other in times of need. And I'd just like to also congratulate and acknowledge Congressman Hakeem Jeffries, the gentleman from New York, who is also host of this special order. I appreciate the opportunity to discuss an issue that is very personal to me. Before I begin, I just want to say that my heart goes out to the families and friends of the victims of the horrible tragedy in Orlando. And I can only imagine what they're going through. The other thing that's very illuminating to me is that as we came here and stood up for a moment of silence, after that moment of silence, I believe members were given a 1-minute opportunity to speak on any topic that they'd like to on the floor, as is customary. And not one person from the other side of the aisle mentioned what happened in Orlando. So not only was it a moment of silence for the leadership in this House, but it appears that it's going to be a moment that remains silent, or a topic that remains silent from the other side of the aisle. Madam Speaker, eliminating racial-based health disparities depends on our ability to advance access to affordable health care for all. Even in the 21st century, health disparities are stark, especially in the African American communities, where life expectancies are lower and infant mortality rates are higher than among whites. Today, despite improvements in overall health in the United States, African Americans and other minority populations lag behind in numerous health areas, including access to quality care, timelines of care, and health outcomes. For years, the Congressional Black Caucus has called on Republicans to join us and other House Democrats in developing a plan to eliminate racial health disparities, a plan that addresses the causes of health disparities, such as inequities in the environment, social and economic conditions in our communities. Instead, we get from them proposals like their so-called Better Way poverty proposal, a stale repacking of failed policies presented under the guise of concern about Americans trapped in poverty. Cutting job training programs, food assistance, and Head Start will push low-income Americans further into poverty, making it even more difficult for them to access the affordable and quality health care needed to secure their well-being and the well-being of their families. We need to instead use government as a source of good. Every American deserves to live in a safe and healthy environment. Yet, low-income and minority communities are much more exposed to high levels of pollution, resulting in serious health problems such as asthma, heart problems, and cancer. This is a very real problem across America, a very real problem in my district. 13 million people, including 3.5 million children, are concentrated in the vicinity of transportation facilities and are exposed to unhealthy levels of air pollution. My district is the home of Port Newark Elizabeth Marine Terminal, part of the Port of New York and New Jersey, the third largest port in the country. According to the EPA, 25% of children in Newark suffer from asthma, 3 times the state average. What we need are additional federal actions to reduce harmful air pollution from ports and congested components of the national freight transportation system. This issue is critical to the low-income and minority community who suffer the disproportionately adverse health effects of these environmental hazards. Now, since I'm on the topic of environmental justice, I just want to remind everyone that the Republicans continue to block any action to help the thousands of children facing lifelong damage from drinking water poisoned in Flint, including a vote to block families of Flint act in emergency supplemental way. Their radical refusal to address this health issue will have tragic consequences for families, and I think it is representative of their overall inadequate approach to health disparities in minority communities. The way to eliminate racial health disparities is neither to downplay them nor cut programs that will assist the most vulnerable. It is to address the environmental and social and economic conditions that exacerbate those disparities. It is to expand access to quality health care that could eliminate or reduce the onset of many of these chronic illnesses and disproportionate health outcomes. It is to maintain and strengthen our investment in health care access and resources for disadvantaged populations. So in closing, Madam Speaker, I also want to stress health education must also be a focus in any efforts to eliminate racial-based health disparities. African Americans and other communities are disproportionately affected by poor provider-patient communication and health literacy issues. Consequently, they often do not have the access to information that enables them to make the appropriate health decisions. We have a responsibility to work with our healthcare institutions and community health centers to make it easier for people to find and understand and use the information and services. As co-chair of the Congressional Men's Health Caucus, I have hosted and participated in a number of outreach events in my district to engage directly with constituents about the importance of making positive health decisions and staying proactive about their health and well-being. So I encourage everyone watching at home to get the information you need to make smart health decisions, to get the security you and your family deserve, to get the health care that we all need. And with that, Madam Speaker, I yield back.
Thank you so much, Congressman Payne, for giving us such compelling information and data and reminding us that the time is now for us to enact those programs that work. The time is now for us to understand what is at risk. And also let me thank you for your role on the Congressional Men's Health Care Caucus. At this time, I would now like to yield time to the gentle lady from the 18th Congressional District of Texas, to someone who I'm always amazed when she comes to the mic, someone who is well-researched, someone who delivers an oratorical message that makes us take pause and attention. Tonight, I'd like to say that she is a movement. Earlier, I heard her use that word and talk about how we, Madam Speaker, must be the movement against violence, that we must be leading that movement against these disparities in health care. Now I would like to yield to that gentle lady from the great state of Texas, 18th Congressional District, Congresswoman Sheila Jackson Lee.
There's no doubt how much I appreciate the Congressional Black Caucus and you, Congresswoman Beatty and Congressman Jeffries, for always being timely, for allowing us to give a message to our colleagues. We hope maybe the American people will hear us, but we accept that this body is the body to which and to whom we speak. So I am thankful for that. And I want to pay tribute overall to the Congressional Black Caucus because we were actually here speaking of health disparities because it was the caucus that triggered this debate through the years that we've been trying to get universal access to health care and was the moving force in the 2009, 2008, and 2010 passage ultimately of the Affordable Care Act, where the work that we did, joining Congressman Donna Christensen at that time, and Frank Pallone on the Health Caucus, but in the CBC we had the Health Disparities Task to ensure that the language in the Affordable Care Act addressed the issues of health disparities. And there was a large section on that built on some of the work that some of us had already done, creating an Office of Minority Health that I'd worked on in years past. And so it was the lightning bolt of the caucus and then working with the Asian Pacific Caucus and the Hispanic Caucus that we raised the issue that no one was talking about. I remember debating on the floor of the House on the issues of dealing with senior citizen African-American men and how they access health care. How do women access health care? How do people impacted by diabetes access health care? Some of the diseases that are a proclivity to the African-American population. And we were finding out that we even had an issue where medical professionals didn't know how to ask the questions. How do you address someone who needs to be diagnosed for prostate cancer or may be diagnosed for prostate cancer and is an African-American male, a senior citizen, as my father was, who ultimately died of cancer that metastasized from the prostate to the lungs and the brain. And so we knew we had a serious issue. And so today I want to mention 4 points, but I'm going to focus on the last one. Obesity, a question of access to health care and physical fitness. And many times we live in areas where there is no access to a pool, a tennis court. Mental health. If you lived your life in a segregated America, if you were called boy and girl, it's a different mental health situation than maybe others may have faced. If you live in a situation of poverty, of a single household, maybe, this is not across the board, these issues will be impacted. If you lived around gun violence, if you saw your 15-year-old friend being shot dead in the street, there's a question of mental health that we need access to that care for us to be able to reach out, or maybe counselors to be able to provide for children. HIV/AIDS is something that we've lived through. I remember going to funerals of friends in the 1980s and into the 90s. Particularly with HIV/AIDS. And so we have worked in the Congressional Black Caucus to massively talk about testing. But let me get to this point that I want to dwell just for a moment on, and that is gun violence. I was here on the floor earlier with my head held down and my heart heavy as my district today had a memorial, and they had one yesterday, we'll have one tomorrow, and have one on Wednesday. I mourn with Congresswoman Kareem Brown. We're offering legislation dealing with the assault weapons and to complement the legislation already passing or already in place. But it is important to note that this is a health issue because the Centers for Disease Control can assess and study every health issue that faces America today, but they are legislatively, by law, prohibited by my friends on the other side of the aisle, by Republicans, to disallow every year to give them permission to study gun violence. And gun violence is killing our children, killing our families, and in Orlando it killed Latinos who happened to be the attendees at the Pulse Club. The LGBTQ community was the dominant community, and a hateful terroristic act using AR-15s and Glock guns killed them. The incident was the deadliest mass shooting Next most deadliest incidents in recent history were April 16, 2007, Virginia Tech, 32 killed, 17 injured. December 14, 2012, Sandy Hook, 26 killed, 1 injured. October 16, 1991, Killeen, Texas, 23 killed, 27 injured. And according to Everytown Index of mass shootings in which 4 or more people are shot and killed, the incident was the 9th mass shooting in the United States in 2016 and the 150th mass shooting in the United States since January 1, 2009. The mass shooting with guns impacts both the mental health, the sanctity, and the minority community. And it is shameful that we are not allowed to engage in the kind of research that Professor Stith of Harvard talked about, and that is the assessing of violence, and the assessing of violence with guns. Materials I have before me make it very clear that most of these violent acts are done with guns. Done with guns. San Bernardino, Chattanooga, Charleston, Garland, Oak Creek, and Fort Hood were all done with guns. And so I stand here today to challenge this issue of health disparities, to say that the heavy brunt of killings, singular killings, are impacted by poverty, lack of access to health care, and the proliferation of guns in our inner city communities, and the failure of the United States Congress to put real gun safety legislation, closing the loophole, the Jim Clyburn rule that says that if you don't get the review and approval by ATF, then you do not get the gun. You have to wait until you get the approval from ATF, who may be trying to determine whether this person with multiple problems, mental health or background issues, doesn't need to get a gun to then ultimately to go kill their spouse, their children, their neighbors, their family members, or strangers. And so it is my belief today that this health disparities debate is crucial, and we should come away from here recognizing that obesity and the issues of mental health and HIV/AIDS can be, with great investment, researched for cures, or cancer that proliferates in our community, triple-negative breast cancer, that is legislation that I have put forward and have gotten passed about that impact. But it is the gun violence that we're doing absolutely nothing about, and the disparities and the impact of minority communities is atrocious. I want to close simply by saying the word or the acronym the LBTG community, excuse me. I want to say it over and over again, because I think it is shameful that in our debate, in our recognition of the tragedy of Orlando, that we don't acknowledge the horrificness of the hate crime and the hatefulness against that community. And as I stand here, that community is diverse, and there are African Americans who are LBGT. And so I would ask that as we move forward this week, that we will be reminded of this hatefulness and we'll have a cure. We'll be reminded of this violence and we will have a cure. And that cure, first of all, will be to restrain the use of assault weapons and these weapons of war type bullets that men and women in the United States military say has no business on the streets of America. I believe, Congresswoman, that health disparities is an important wall and division to overcome. And I thank you for having this special order to ensure that we will confront these issues and try to save lives. I yield back.
Thank you so much, Congresswoman Sheila Jackson Lee, and thank you for reminding us that we should be done with guns like the assault weapons. Thank you for reminding us of the impact that health disparities have on our community in this nation. Madam Speaker, I have two documents that I would like to request to be entered into the records. First document is from Congresswoman Eddie Bernice Johnson, and for the record, I'd like to state who was the first nurse to serve in this United States Congress. And the second is a portion of the special features on racial and ethnic health disparities, a 30-year study after the Heckler Report. Thank you, Madam Speaker. Madam Speaker, we have heard a lot tonight. We have heard the call to action by members. We have heard the relationship to poverty and health disparities, to the socioeconomic conditions of African Americans, to health disparities. We have heard the relationship to deaths by guns to health disparities. We have heard the data and the statistics about the mortality rates on or from diseases like cardiovascular disease, leading killer for women and African American women and men. We have heard about the effect of untreated diabetes and how that affects African Americans. And the list goes on, Madam Speaker. I could tell you whether it's obesity, whether it's stroke, and certainly as a stroke survivor, I understand firsthand the value and the importance of quality, affordable health care. I could share with you that there are some federal programs that actually work and bridge the gap. I could say wonderful things about the United States Health and Human Services Office of Minority Affairs that provides data and research and services for us. But before I ask my colleague, Madam Speaker, to say a few words, I ran across something that was said, in my opinion, by one of the most powerful individuals that will go down in current history. And 20 years from now, Madam Speaker, if I were standing here talking about his legacy, health care would be one of them. And let me conclude my part with these brief words that he quoted on April the 1st of this year. Our nation was built on an enduring belief that we are all created equal, regardless of the color of our skin or the station into which we were born. From the ambitions we hold for ourselves to the ways we take care of our health. This founding premise serves as the guidepost of our national life. Yet to this date, Madam Speaker, minorities continue to experience the health care gaps that leaves their communities, our communities. And I will add in this to his ending that, Madam Speaker, tonight the Congressional Black Caucus asks that we recommit to taking action to overcoming these disparities. End of quote. And that person who will leave a great legacy for these words is no other than our President of these United States, President Barack Obama. And now, as we begin to close our hour, I could not think of a better colleague, a better co-anchor to come and share with us our call to action. My colleague and classmate, Congressman Jeffries, is a scholar, someone who sits back, listens, and then comes with resolve. He is someone who is no stranger to this process of telling it like it is. He is someone who has spent a lot of time and years with his experience to speak for the individuals of his district. But tonight, Madam Speaker, I asked him to speak for the Congressional Black Caucus. I asked him to close us out on our call for action as we talk about the health disparities in our African American communities. And he is the co-anchor, Congressman Hakeem Jeffries.
I thank my good friend, the distinguished gentlelady from Ohio, and our phenomenal anchor for this CBC special order hour today and throughout the second session of the 114th Congress. It's been an honor and a privilege to work closely with you, and you've done such a phenomenal job, not just on behalf of the people that you represent in the great city of Columbus, Ohio, but all throughout the nation in your various roles and certainly in your leadership in the Congressional Black Caucus. It is with a heavy heart that I stand on the floor of the House of Representatives today and with great sadness acknowledge the pain and the suffering and extend my condolences to those who have suffered this great tragedy in Orlando, Florida, the worst mass shooting in the history of the United States of America. It's a complicated shooting. We understand that it most likely is an act of terror, a hate crime of unspeakable proportions. There's indications that the shooter may have some degree of mental illness and a history of domestic abuse. The shooter appeared to have been in some measure on the FBI's radar. But you can add all those things up, and there's still something that's missing that we here in Congress have the capacity to deal with, and that's the fact that one individual was able to purchase a weapon of mass destruction, which should be reserved for war, not the hunting of human beings in this great democratic republic, and inflict death on 49 individuals and maim in ways that are inhumane more than 50 others. Martin Luther King Jr. once said that in the end we will remember not the words of our enemies, but the silence of our friends. And during the 114th Congress, there have been more than 100 mass shootings. We often come to the floor of the House of Representatives, and the Speaker or one of his designees stands at the rostrum and asks us as members of the House to engage in a moment of silence. And then we go on with business as usual, having done nothing about the tremendous gun violence problem that we have in America. The rest of the world is looking around and saying, what are we doing in the United States of America? 5% of the world's population, 50% of the world's guns. It's estimated that there are more than 300 million guns circulating throughout this great land. And the FBI and local law enforcement can't tell you where the overwhelming majority of them are because of legislative silence and malpractice. This is an issue, of course, that has great impact on the African American community. Homicides, the leading cause of death through guns of younger African American men. And so we in the CBC, we view it as a public health crisis, certainly for our community. I think it's one that all Americans should view as a health crisis for the entire country. But the thing that is also troubling, and we'll have time to deal with this tragedy, and hopefully we'll be able to make some common sense steps in the right direction, including making sure that individuals who are on the terrorist watch list can't purchase weapons of mass destruction. How complicated is that to do? But the thing that's striking for many of us in the African American community is that when you look at some of the leading causes of death, heart disease being number one, and then of course diabetes and childhood obesity being problematic, certain forms of cancer, HIV, AIDS, infection. Many of these illnesses, these ailments that plague the neighborhoods that I represent in central Brooklyn and Bedford-Stuyvesant and East New York and Ocean Hill, Brownsville and Canarsie in the west end of Coney Island are preventable. Preventable by better exercise, preventable by dealing with some of the environmental racism that many low-income communities of color have been subjected to, resulting in incredibly high rates of asthma and other forms of respiratory illness, preventable by better diet. Senator Booker recently said to many of us, and this has stuck with me, that more African Americans in the United States of America die as a result of drive-throughs, not drive-bys. That's because the diet, the access to healthy food is limited. The food deserts within which many African Americans, particularly at the lower socioeconomic level, are forced to reside in are scandalous. So we in the Congressional Black Caucus believe that we've got to deal with these issues in a more meaningful, comprehensive fashion. I'm thankful that back at home in the west end of Coney Island, the Coney Island Cathedral, one of the most important religious institutions in Brooklyn, is actively engaged in a public health campaign to deal with diabetes and heart disease and many of the other ailments that result from the poor diet that exists, the lack of access to healthy food in the black community. It's a campaign that we want to take across the nation. We're thankful for the work that has been done by the Congressional Black Caucus and by President Obama through his leadership of the Affordable Care Act. We now know that more than 20 million previously uninsured Americans now have access to quality, affordable health care, disproportionately African American. That is a positive step in the right direction, but instead of trying to dismantle this monumental step forward, as House Republicans have attempted to do more than 60 times over the last few years, you have a clinical obsession with a law that has been declared constitutional not once but twice by the United States Supreme Court. Let's figure out ways to come together as a nation, despite our racial, religious, ethnic differences, to deal with the disparities that exist in the African American community and beyond. And let us come together as a Congress and as a nation to deal with the scourge of hate in its most recent form directed at the LGBT community down in Orlando in such a horrific and invidious fashion. We're better than this. We can do much better here in the United States Congress. The Congressional Black Caucus is here to lead the way on issues, work in partnership, hand in hand with our colleagues on the other side of the aisle, if you're just willing to meet us some of the way to deal with the issues of health disparities in the African American community and deal with the scourge of gun violence that takes our young boys and girls in shocking numbers and also impacts people all across the country. So I thank the distinguished gentlelady for your leadership and for once again yielding to me and anchoring this special order in such a phenomenal way.
Thank you, Congressman Jeffries. Madam Speaker, as we close out tonight, I can't think of a better way to take my last 30 seconds than to speak to you and to speak to America and to ask that we take these last seconds in silence as a call to action to prevent the guns being on the street, as a call to action to reduce the health disparities, but in honor of the families in Orlando, we give them our commitment that we stand with them and that I stand with all of my friends and constituents and supporters who belong to the LGBT community. And I yield back the balance of my time.
Back.